Welcome to the Disruptive podcast by Minority Innovation Weekend. Minority Innovation Weekend is a weekend summit dedicated to aiding innovators of color launch tech-focused startups, exploring emerging technologies and showcasing tech startups that have a founder or co-founder of color. During each episode, we will discuss innovation, tech startups, and more. Minority Innovation Weekend. One weekend, endless opportunities. Please visit www.minorityinnovationweekend.org to find out how to connect with us and to register for upcoming events.
So welcome to the MIW Disruptive podcast hosted by Sir Walter and Jerome. Today we have a special guest. She is the CEO and founder of Rubitection, which is an early pressure detection biomedical device. I am talking about Dr. Gaspard. How are you?
I'm doing good. I'm happy to be here. Happy it's Friday. Happy to see how we can spur some innovation in the community.
All right, I like that positive attitude. All right, first question. Positive energy, really. It's a Friday.
It's a Friday. Or as some people like to say, Friday.
That's right.
All right.
What motivates you to start a company? Well, you actually you founded two companies around early pressure detection.
So I did found two companies. One was a pediatric robotics company called TLneoCare. I did that also while I was in grad school. And the second one was Rubitection, which is, because I'm still doing it, a medical device for skin health assessment and care management with applications to dermatology, wound care, and surgery, where our initial application is towards early diabetic foot ulcers and bedsore detection and care management with the goal of prevention. What motivated me to start those, I was basically self-motivated. I've always wanted to run my own company for a few reasons. I saw my dad running his own company, and as an immigrant, I come from a community where people started their own businesses all the time. It was never not an option. And I saw it as an option that gave people more control over the direction of A, their career, and B, their vision on executing on their innovation. You know, when you work in a corporation, you have to do what they say, and you could be 90%, 95% in a project about to finish and launch, and they say, nope, we're not doing that anymore. And your years of work is just now, gone. So I wanted to be in a position where I could have more control in working on things that I was interested in and how they impacted the community, essentially.
Gotcha. So as you said, you grew up on a Caribbean island, I believe it was St. Lucia. So how did that cultivate your problem solving skills?
So I think it was because I grew up there in my formative years. So I was there from birth to 5 or 6 before we moved to America. But those are your most important formative years. And it was an environment where you were always continuously mentally challenged in how you answered questions by my family, how you answer questions and how you engage in your community, and where you're always seeing people who may not have access to all the resources and are always problem solving on their own and running their own businesses. And the community was predominantly Black. So, I saw Black people as the bankers, Black people as owning the bar, Black people as the politicians, Black people as the police officers. Black people ran the town, the country, more or less. And so, they ran the government, they ran everything. So it also gave me a mindset that, that Black people have no what's a good way to say that? Black people.
There was no limitations.
No limitations.
Mhm.
So coming to America when people were like, oh, you're Black and you're doing that. And I was like, I don't understand that concept.
Right.
It's your life. You should do what you want and not allow people to dictate what you can do. But later on, I understood that it was less of that and more that, if you grow up in an environment where that's oppressive, and people are always telling you can't do something, and then they don't allow people to do it, so you never get to see someone in that position, it's hard to think that you can also achieve it. And so growing up in the Caribbean removed all of that for me, because then when people tried to tell me that, I'm like, that's not true. I can point you to a whole island where they're running the government, they're running the police department, they're running the banks, they're running the law firms, and we're fine. So I think that was a huge advantage, because it basically, I didn't need to ask anybody approval to do anything I wanted. Well, I didn't feel that was necessary. I just did what I want to start a company, I started a company. I was like, okay, I want to go to grad school, I'm gonna do that. I'm like, okay, I like making stuff, let me see what career that is. Engineering. Okay, so I'm gonna major in engineering. Yeah, so it kind of gives you a freedom of mind that I think is harder to access if you grow up in your formative years in America, because there's so much oppression here, unfortunately. And then people unknowingly think it's true because they haven't seen anything else.
All right, you brought up an interesting point. You chose engineering. Why did you choose biomedical engineering? What kind of led you down that path?
I would say I loved biology. Well, the full story of how it started was that I was like 17, trying to figure out what I was going to do for the rest of my life, thinking that, what you major in college is the rest of your life, which is absolutely not true. Most people do not end up working in whatever they major in. But I was, it was also, of the mindset too that, if you make a career of something you like, it's not really work. So I was trying to find something that I like. So at 17, I was like, what I was into at that time was biology and the sciences. I was also into like making things, designing, creating things. And I was also into babies, which are a very just weird combination, but in hindsight, but that's were the things that excited me at the time. So I wanted to do something in healthcare because I like babies. So at the time I wanted to be a neonatologist. And so that would allow me to work with babies as a doctor and be in the sciences, because you have to study science to be a doctor. And the making things, I thought, in the hospital, you don't always have everything. You have to kind of make your own solution sometimes. But then when I was, so then I wanted to be a doctor. But when you go to college, there is no major that is a doctor. Right? So then I was like, okay, so you have to have an actual like something you can select that's a major. Doctor is not one. So then I was like, okay, take baby out, which is what makes me want to be a doctor. What's left is the sciences and making things. So I literally went into the library. This was the time before the internet was really everywhere. And, they have those huge career books. Like, I don't know if you guys remember those like big volumes of career books.
Right.
And I basically went to the library and looked for things that were, I started off with biology and sciences. So I was like, okay, what careers are in sciences? And, it's like biologist, blah, blah, blah. Okay, and I was like, okay, so now I need to find something that's in biology that overlaps making things. And I was like, what do people who make things called? So I went through the book, the appendix, making things, okay, engineer. So then I went to the engineering section of the book and I was like, okay, engineer. And I read it again, came across biomedical engineering, which was a combination of biology and engineering. And I was like, oh, I think I found my major. So then I majored in biomedical engineering going into college, but was pre-med so that I could, because you can't major in medicine. So I was biomedical engineering pre-med with the goal of going to med school. And yeah, and because it combined the two things I really liked, I loved it. And after doing an internship to go into med school at a hospital in Miami, I decided I didn't really like the medical environment for work. Like, I don't like the work-life balance. Granted, being an entrepreneurship is not much better. But at the time, I was like, okay, I don't like the work-life balance. I'm also somewhat germophobic, so like having to go to a hospital that is full of sick people every day for work was giving me anxiety. I was just like, oh my goodness, what if I catch something at the hospital? Like think of COVID. Like you're working, you have to go to the hospital. That's where your patients are. And like, what if somebody had some infectious disease we don't even know about? Which 10 years ago would have sounded crazy, but now it's not so much crazy, is it?
Right. True.
But before they've identified what it is, you're just doing your job. Now you've got an infectious disease no one's heard of. And I was like, that's just too scary for me. I don't want to do that. Understanding biology and like it's the small things that are going to get you. Everybody worries about, getting into a car accident and etc. But I'm like, you can get a microscopic germ. You're never going to see it. And then you're just going to die. And everybody's going to try to figure out what it is and figure out it's this little tiny germ, AKA now COVID, that's just killed people. And I was like, that is too scary for me. And so I dropped the pre-med and just stayed biomedical engineering.
A shout out to the frontline workers.
Right.
You see how brave they
Right.
And also I like how you broke that down. You started with the problem and you work backwards. That's what engineers do.
Yes, and this is how you see how brave the frontline workers are. But I had that foresight, and I was like, I don't know if I'm brave, but I don't know if I don't know if I can lay down my life for the cause. Unknowingly.
Right.
It's one thing if but until people figured out what COVID was, people were still coming to the hospital, and people didn't know what was going on or how to protect themselves, and a whole bunch of doctors died.
True.
Initially, it was the doctors who were dying until they figured out what was going on, right? And then and that could be you,
right?
That's scary.
I totally agree with you on that. Totally agree.
Shout out to the doctors.
Right.
You see how strong and brave they are, and I have friends who are doctors, so more power to them. We need them, but I couldn't do it. And that one, what class was that? Either biochem or there's a class in biology that you learn about all these infectious things that could kill you. And I was like, yep, no.
Okay.
That was it for me.
Gotcha. All right. Let's turn and talk a little bit more about your company, Rubitection. So what is the significance of the name of your company, and how did you go about constructing your team?
So the significance of my company is that it represents or denotes what the company is doing in Latin. So we have a device, I'll show you here. We have a handheld device that you place onto the skin to make a measurement and to assess the health of the skin and evaluate the progression of skin conditions. And it does that by monitoring changes in skin redness associated with inflammation. And so Rubitection literally means detection of redness in Latin.
Gotcha.
So it actually literally describes what the device is doing.
Gotcha.
Yes. And then in terms of how I built my team, I'm still building my team, but what I initially started out doing was focusing on individuals who had the skill sets to help us build the technology. Because without the technology, we can't collect data. Without the technology, we don't have a business.
Right.
There's the problem still exists, but we don't have a way to solve that problem. And therefore, we don't really have a business. So initially, I started out with people who have a technical background who can help with scaling down our design. Then I focused on having clinical people who can help with clinical testing, and then added in business people to support business development and marketing. So we're still currently growing our team right now. We have worked with a lot of interns, and we're now in the process of trying to hire some full-time people. But essentially, at the high level process was I needed to understand first where I was trying to go with the business, versus where I was, and then figured out what do I need, who are the people, and what do I need, and who are the people who can do that, who can get me from point A where I am right now and point B where I need to go, which is at a point where I have, let's say, a scaled down functional prototype, some clinical data, some engagement with corporate partners, indirectly validating the market, and positioning to go into the next phase, which is, say, product development, manufacturing. So once you identify the goals or milestones you need to achieve, you identify who has a skill set to do that work, and then you go out and find the best people you can, and then if you don't have money, negotiate, and then hire them.
Okay. Understand, negotiate. Gotcha.
Negotiate. Be a part of our success story today and get paid tomorrow.
There you go.
But you'll be rich.
Right. Oh, so you give it what questions are you offering stocks to people for coming on?
Yes.
Okay, gotcha.
You offer stock. You should offer stock, but also because it's it takes like a village. Having a startup is like having a baby, and thinking of the Black community, it's like having your aunties and grandmother help you raise that child. And at the end of the day, everybody wants to be invited to the graduation.
Right.
The high school graduation, you can't just be like, oh, it's just the parents. People will be like, who babysat for you when you had to go to work and work 2 jobs? Auntie Nina, grandma, see, and why aren't we invited to graduation? So you have to think of it as a community effort. You without all of those people, you can't be successful. And so you want to share the wealth, first of all, share the wealth. And you want to, because by sharing the wealth, you're also building your community. And you want to give credit to people who helped you get there, because you couldn't do it by yourself.
All right. Speaking of giving credit, is your technology patented?
Yes.
Could you tell us a little bit about that process of getting your product patented?
Yes. So the process for getting the patent, I'm going to keep it high level. It could be a little bit, yeah. It could be a process sometimes, but I'm going to keep it high level. So the first thing you'd want to do is understand what the competition is, like who are making similar devices to yours, even if it's being used for something else. And so to do that, you'd want to do a Google search and then go to the patent website and do a search on the patent website to see, similar technology. So if you had like a handheld sonic device for brushing your teeth, you'd want to go to the USPTO site, click on patents, hit search, and do sonic system for brushing teeth or sonic system toothbrush, and see all the patents that come up. This is also, I should put a disclaimer, this was my process.
Okay.
So then after you do that search and figure out what's going on there, find the top most applicable patents that are either similar or in the same space. And then you want to do a feature analysis. So feature analysis is that you take all the patents, see what they have in common, and see what they have that is different. And through that process at a high level, you can basically figure out where there's a hole in the market in terms of patenting and where you're similar. So the things that you're very similar on, without adding additional features or different processes, it's going to be hard for you to get a patent. So you figure out where all of the competition is. Like everyone's over here. Like I'm just gonna pretend like everybody's in a circle here, patenting just the sonic stuff. And maybe you have sonic with toothbrush and a mirror, and nobody has that combination. So in that gap, you know that you can file a patent and submit a patent for that without a high probability of rejection. At that point, you want to then get in touch with a patent attorney. You could get in touch with them earlier, but you'll pay more money. At that point, you want to get in touch with a patent attorney, kind of write out all of the major design features and use cases of the technology. They will work with you to put it in legal language. All of the patents that you found before, you want to list those in there because it helps the patent office identify what's already in the market and kinds of gives them the starting point. So they can understand that this is what's currently available and better understand how you're different. And then you basically submit that. You'd want to do a provisional first, also to give you a hold for a year. So no one else who has the same idea as you can get the patent for you. Once you submit it, it takes a while for the patent office to get back to you, like a year or two. And then they tell you if it's approved or not. If it's not approved, they give you an office action. And you just have to fight those, arguing that no, this is why we're different. And sometimes make some adjustments that they feel are necessary to highlight how this is different. It could be a process, a multi-year process that's expensive.
Right. Okay. Good to know. Good to know. So like one of the things that always, since we've been doing this, is getting feedback on CEOs and founders about their experiences being a CEO founder of their company. So what has surprised you most about being a CEO, about your CEO of Rubitection?
What has surprised me the most? I would say, what has surprised me the most is that I would say two things. One, being the CEO, somebody told me this early on, but I think I didn't quite understand it because I was fresh to the job. But being a CEO is really about delegation and people management. That's really your only main job. As CEO, if you find yourself doing too much hands-on work, you're not doing your job. Right? Your job is to find people who can do the work, delegate, and make sure everybody's doing their work to get to the goal. Gotcha. Which is very different than what I think most people think a CEO is. Job is. So it's really a people person's job. Like you have to be interacting with people all the time, kind of staying on top of where everything is going, not necessarily doing it yourself, right? And the other thing I would say that took me by surprise is that it's really all, I would say in all honesty, 90% of the CEO job is just networking. Back to that concept that it takes a village. When you think about it, with equity, that's thinking internally, that you want to support, support the people who are helping you grow the company and give them credit through equity. Right. But externally, in terms of partnerships that you need to grow the company, funding that you need to grow the company, even finding team members or, scaling the company, which is really the job of the CEO in terms of setting that vision and then working with their high-level team to get those resources to execute. That's all networking. So that's another, I think it's another aspect people don't think about when they think CEO. Like your job is network with as many people as you can to get access to the resources that you need. And essentially it's almost like a networking hierarchy also. You have to network your way up to the right people. Like you don't expect that you're just gonna get access to the people you need.
Gotcha, okay.
Right, like you have to work your way up, use social capital of who knows who to get to the right spot. Otherwise, you're just running in circles and not going up.
Speaking of social capital, how early on did you kind of take on advisors for your company?
I took on advisors right away because I didn't know everything and I needed people who had more experience. So I took on advisors right away, talked to a lot of people, got their opinion on what should be going on with different aspects. Because, when you're running a company, it's not just, dealing with the product. You have to deal with marketing, to deal with the technology development, to deal with the clinical evaluation. You have to deal with potential sales and understanding how that affects all the other aspects of the company. You have to think of operations of how the company is working. And your partnerships. There's not one person who knows all those things. There's experienced CEOs who know how to delegate and manage people who manage those things, but they don't. If you ask them what's the FDA process, they're like, I don't know. Let me call my FDA specialist. Hello. Can you tell me? Can you answer this question? Like their value is access to people who know what they're doing, and they just manage and delegate. So with that said, starting out, you need advisors so you can have that person you call when you're like, this came up, I'm not familiar. What's your thoughts on this? And you want advisors that are specific to each topic. Clinical advisor, a business advisor, a sales advisor, a manufacturing advisor. You can't be expected to know all those things, and you want people who know more than you.
Yep, makes sense.
Yeah.
So let's talk a little bit about some funding. So of course you participated in the Seattle Angel Conference 19, and so you participated. So did your pitch prove fruitful in terms of receiving investment to your company?
I would say yes and no.
Okay.
So they had a main competition which was for 200,000, and so we didn't end up winning that one, though I think we were in the top 3. But I've not yet confirmed that. But we came 1 point away also from winning the Audience Choice Award. Apparently, as I said, networking, I needed to have more people voting.
Right.
Because 1 point away, I mean, I hate when I hear that. You lost by 1 point. I'm like, 1 point? I could have called my mother and be like, vote. You know what I mean?
Right.
Yeah, so we didn't get the main award, but people were still interested enough that they are doing a sidecar investment where people who are interested in the company still get together and put in funding. But at the same time, along with the Seattle Angel Conference, we also recently pitched at Keiretsu, which is a larger conglomerate of angel groups and investors. And so there was some interest there. So we're following up with some of the members from Keiretsu and the associated angel groups that were there. And we also recently won 2 other competitions. Berkeley had a health innovation competition called Ready, Set, Health. So we took first place there. Nice. And also Lightship Capital had just a startup competition. And so we took first place there, and that was all in the month of May. So all of that was kind of happening at the same time with SAC.
Well, congratulations.
Yes.
Those 2 first places.
Well, thank you. Yes. Thank you. So we're hoping all of these things kind of position us and provide opportunities for networking to get access to investors who would want to invest in our seed round, whether they are early stage VC groups or high net worth individuals who either want to support improved healthcare or support minority or women founders. I'm hoping possibly one of them are listening to your show. And we're
You never know.
That's right.
What did I tell you? The job of the CEO is always got to be networking.
That's true, right?
So we're raising a seed round, and technically as a startup, you're always fundraising. So even if somebody sees this in 2 years, I'll probably still be fundraising to get us to the next level.
Gotcha. Okay.
So whoever's interested, feel free to contact me at info@rubitection.com with the subject line "Interested in Investment." Yes.
All right. That's a full pitch right there. All right.
It's a half pitch. It's not the full pitch.
Not the full pitch. I'm sorry. Yeah.
All right. Here's some news about this week. Google recently announced a new AI app to diagnose skin conditions.
Yeah.
I read an article about it in Vice. They were saying the new dermatology app wasn't designed for people with darker skin based on the choice they made and the amount of data they used for the data set. There is an opportunity for tech companies like Google to better incorporate a more diverse data set to feed their AI enhanced products. How will you solve this problem if you were in charge of that product?
I feel like that's an easy question. But essentially they are using AI to do image processing, to do skin lesion, skin condition classification. Really all they had to do to make sure that it worked was include more pictures of darker skin patients. But I feel also, as someone who's in the skin health space, first, I think Google should call me. I think it's a great opportunity for partnership, because
Right.
my focus is on doing equitable skin health assessment. Secondarily, as someone who's also in the space, I understand how hard it can be to get access to images of people with darker skin tones. There's a dual problem. There's not a lot of doctors or dermatologists who are people of color who have experience with dark skin to do those diagnoses accurately. And there are not, in my experience so far, and my experience so far, and specifically in the US, it's hard to get access to facilities that have a high number of images of dark-skinned individuals. But I read the article, and they didn't have dark-skinned people in their database at all. They had white, dark white, which is still white. Just clarifying, white and dark white is a white person with a tan.
Right.
Right. That's still white. I think they had some brown, which if I had to assume was probably like Indian, or darker skinned Asian, but they literally had no Black images, no African. Granted, they didn't denote it by race, because you can have Black people who are lighter skin tones, right? And you can have, for example, Indian people, who are as dark as DJ, right? And you have Asian people who are Sir Walter's skin color. So it's not really about race, it's really about skin color, but they had no dark skin tone images in there. And I'm behooved by how they thought that was not necessary. And that was, in my opinion, that was basically negligence. You're essentially purposely designing a tool that doesn't work on those people. So as a technologist, and I'm not sure their thinking behind it, just being a part of some of the image analysis development myself within my company, doing feature detection on darker skin tones is actually really hard. So if they were just trying to get a tool that was working and, thinking as a business, we just need to get something out as fast as possible, something that works, and then we can always optimize it over time as we get more users, assuming more of those users will be darker skinned people, not realizing if it doesn't work on us, we're not going to use it. So that kind of has a fallacy in that theory. But, thinking from a business standpoint, they were thinking, let's get something to market as fast as possible that works and not invest in the harder part. So they were doing like low hanging fruit first.
Right.
Doing analysis on fair skin is pretty easy because, you slap them, their whole face is red. You see everything on darker skin tones because our skin is darker. Again, independent of race, it's hard to see, if I slap DJ or Walter, I would never slap you, but I'm just saying. Let's rephrase that. If you guys, let's just rephrase that. If you guys slapped each other,
all right.
Nobody would ever know unless you guys told. Because even if your face turned red, nobody would see it. But for things like cancer and cuts, obviously you can see those things. If we have a rash, it's also harder to see. Even though our skin might be red, you can't see it. So from a technological standpoint, it's really difficult to do some of that analysis on darker skin tones for the same reason that it's harder for dermatologists to see it on our skin. And computer vision right now is not as accurate as a doctor when looking at those color differences to find a problem in the skin. So I have to say, to be fair, I think it was inappropriate that they didn't have darker skin tones and that they didn't make that a priority. There are several ways they could have gone around that, even given the fact that it's hard to find darker skin tone pictures. But at the same time, thinking of it as a business strategy, they may have just wanted to get to market with something that was low-hanging fruit so that they can start generating revenue and prove that there was a market for this, to then validate the investment needed to work on a harder problem, which is darker skin tones potentially, right? Where there are not as many images, the analysis process is completely different. And so your accuracy is going to be different, which means you need way more pictures and way more pictures that are accurately diagnosed, which is hard itself because there's not a lot of dark skinned dermatologists who understand, for example, what does a bruise look like on dark skin? Right. What does a rash look like on dark skin? What does cancer look like on dark skin? Like, they have no idea. Normally they're just guessing. So they don't have all of the fundamental things potentially in place to make the investment to have enough images to build a whole technology on top of that, right? Because they had to have 64,000 images. If I had to do that right now just on dark skin, I don't know where I would go to find those images, in all honesty. I would literally have to leave America. And, I don't have a ton of connections outside of America, but I literally need to leave America, potentially go to places like India or Africa, find a dermatologist or a hospital I could work with to get images. And that would have been my suggestion to them if I was on the team. Instead of saying, let's just leave this out completely, let's at least try to get some images. But then again, it could have been a financial issue. Like, they were just like, we just need to get something out the door. But then again, it's not, it's Google. let's just be serious. This was Google. They have a ton of money, and they have a ton of money to put in R&D. And so it was just an oversight, and they were maybe just trying to get something out the door quick to validate a market opportunity. But it's a fail. But and again, in all honesty, until recently, most people would not have even cared. They would have just been like, Black people would have just been like, oh, another product that doesn't really work on us. And white people would have been like, oh, that's a great solution. And we would have been like, what are you talking about? This doesn't work. It would have been the same dichotomy that we have in society today. So and nobody would have cared, and Google wouldn't have cared. So unfortunately, thanks to George Floyd and everything going on with Black Lives Matter, we can put some more pressure on people to include us in technology development. But I think we also have to take some accountability for that as well as a community. Like, we need to encourage our children to go into the sciences and medicine, that we can have some darker skinned people in the field who know what they're looking at, who are familiar with dark skin and what it looks like. What does a cut and abrasion look like on our skin, and how does it heal, and how do you identify that accurately? And and it's difficult, because then you also know the history of how they have misused Black people in medicine. True. So it's complicated. Right. But one of the main things I think we have to do to solve that is, as a community, take accountability first and get our children into medicine, right? Because, the circumstances where we were taking advantage of as a community in medicine were by white doctors. Right. And it would be hard to convince, potentially, I'm assuming, I would hope, it would be hard to convince a doctor who affiliated with his own community to abuse that community medically, right? And a whole sector of that community. So we can't expect the system to change. And then, I don't know, I'm on both sides of the fence. And again, in all honesty, it's just really hard to see things on dark skin. Even when I'm trying to do it, and I was doing some studies and going out and looking for things, I was like, I'm Black. I've had Black skin all my life. Right. And I still don't know what I'm looking at. I'm like, I don't know. I can't see it. Because the skin is all the same color. And because we have this beautiful melanin that protects us from the sun, it also hides, which is great as we age also, if you haven't noticed.
Oh, definitely. Right. I've noticed on myself. Yes, definitely. Yes.
It's just hard to see, it's hard to see things. Sure. And I'm not saying that doesn't mean that challenge shouldn't be addressed. But specifically for skin assessment, we have to keep that in mind when we're criticizing people about it, because there's a lot of complicated issues around it, from the lack of doctors, the difficulty in doing the assessment, sometimes the fact that technology is not there all the way for some of the analysis, and you don't have access to the data sets. You don't have enough potential data sets that you know with a high level of accuracy that are correct to train something like machine learning on it. Because even if they did it with a smaller data set and say, oh, we had dark-skinned patients, they would have a low accuracy. And then what? We would say, oh, you guys developed something and it works, you know, it has an accuracy of 30% on us. What was the point of that? You know, then we would then we would be complaining about something else.
Right.
So we have to be a part of the solution is my summary. And you have to take these kinds of things in context and understand the limitations of the technology, the difficulty of what they were trying to do, and the access to the tools that they would have needed, the resources they would have needed to do something that would be accurate for us. And we play a big part in that, you know, going to supporting Black dermatologists that they can have more accurate data, encouraging our own children to go into medicine, that we have more Black African descendants in medicine who can have a higher degree of accuracy in making some of these assessments and giving the same urgency in documenting it. I mean, it's a big problem. It's not just a Google oversight. It's a technology, it's a community, it's a medicine problem.
Right, definitely agree with you. That was
a deep answer.
But right, yeah, that was definitely a great answer and a lot of insight in that. But on that, you know, you presented a lot of great information. What's something that we've asked something that we didn't ask that you would like the listener audience to know about?
What I would say is that since the focus is on entrepreneurship, I would say two things. Since the focus is on entrepreneurship, first, know that entrepreneurship comes in many ways. It doesn't just have to be entrepreneurship focused on technology. So, you know, when I was a kid, when I said, oh, you know, people are doing entrepreneurship all the time, it was people who were growing food on their land, Black people who were growing food on their land and then going to the market and selling it. It was people who were building their own bars and running it. It was, you know, you have to look at your community today. Look at your community and look at what's needed, or look at where people are driving long distances to get to, and ask yourself, why is this not in my community? And then start the business to do it. And if you can't get the loan to do it, you can always go to a community bank or the SBDC. You don't know the process, go to the SBDC. So now is like the best time ever where the Black community can kind of, I don't want to say overcome the hurdle because there's still a lot of hurdles, but this is the best time in America that all of these opportunities have been present and the barriers have been the lowest, right? Where people are asking, well, why aren't Black people doing this or that? And trying to figure out why, and then trying to put money into some solutions. So when you see on the news, like all of these high-tech entrepreneurs who are exiting and doing X, Y, and Z, know that you can be just as successful with a donut shop or just as successful with a barbershop if you design it properly, franchise, etc. You can be just as successful with a corner grocery store chain in your neighborhood. And just remember that solving a problem with a good product or in a good way can help you be a successful entrepreneur. You don't have to design the next, you know, commercially ready spacecraft. You know, it doesn't all have to be at that level. You don't have to have like 10 degrees to be in entrepreneurship. Right. Don't fall into that trap, which is kind of where it's kind of going to now. Because that will just hold you back. And I would say the other thing is, don't feel like you need anybody's permission to do what you want. We all have one life to live.
True.
Know that as a Black community, there are obstacles, but I make this argument to people, both not intending criticism, but just stating it factually. Immigrants, new immigrants, independent of skin color, but including Black immigrants who come to America, ones that are really, let's say, focused on entrepreneurship or going and building a career, within 10 to 20 years, they are successful. They figured out, they can't speak, when they get here, they can't speak the language. They don't know how the political system works. They don't know how the educational system works. They don't know the culture. They don't even know where the grocery store is. But they figure out how to get organized, what are the resources they need to be successful. They go out and do it without asking anybody for permission. They're just like, well, this is what I'm going to do, so I'm going to go do it. And they end up being successful and at a much higher rate than African Americans who are here. Not because there's a lack of capability in the African American community. It's just because it's like when you grow up in an abusive environment, you think it's normal. And you think the boundaries that have been given to you in an abusive environment is the boundaries of what is possible. And so with that said, I would encourage anyone who's, in general, to get as much exposure to as many things as you can, which is hard if you're in a low income environment, because most people don't have the means to leave. But, start small, get on the train, get on the bus, and go just walk around the rich neighborhood, see what other people are doing. And when you see someone who looks wealthy, ask them, what did they do? How did they get there? Start where you can. Expose yourself to other things that you haven't seen or done. Realize that there's other ways that you can do things, other things you can do. You don't have to ask anybody's permission or wait for someone to tell you you can do it or have someone lay down the road for you. Just do it and go and see what everybody else is doing and realize if they can do it, you can do it too. Because at the end of the day, if we go way back to the seeding of time, everybody came from Africa. So if you were doing it today, we already did it before. I'm just saying.
All right. Good advice there.
That's right. Dr. Sanna Gaspard, thank you for spending the hour with us. You've been dropping gems the whole time. I've been absorbing it. Now, hopefully our listeners can use it in the world.
Yes, hopefully they can use it in the world. And it only takes one person. You just have to start, what I tell myself, because I don't come from a rich family, start where you can, think big, and grow from there. That's how you get to the next level. It doesn't have to start with like a huge statement. You sometimes don't have the resources to do something big right now, but do what you can right now. Start building the fundamental blocks, put those in place, have a big vision, and then go out there and start finding the resources to continue building. And every time, just keep iterating.
Okay.
And you'll get there.
Sounds good. Definitely want to appreciate you. We appreciate you being a guest on the Disruptive podcast. So thank you very much.
You're welcome.
Yes. And definitely we wish you much success on your technology and the growth of your company. And maybe we have you on again in the future and, you could continue to drop so many jewels like you just dropped on this podcast.
My pleasure. And thank you for the opportunity to be here. I enjoyed the opportunity to talk to you guys. And if there's any way I can help in the future, let me know. Or if there's anyone who's trying to get a hold of me because they have an idea from hearing your podcast, feel free to share my info. Share my info at Rubitection email. It's not my direct,
Of course.
That's your direct email. Yeah. Oh yes, definitely.
Yes, but it takes a community. And until we kind of realize that, the marketing around it right now in terms of entrepreneurship, it's like, oh, this one individual had this great idea and then grew it to something super successful. It took a lot of people to help them.
Right.
It took a lot of people who supported them early. It was a lot of people who either gave them exposure early that they could even come up with, have the mindset to think, oh, I can do this. And so we have to start thinking like that as a community. Like we have to support the community in getting there because that's essentially what's happening everywhere else.
Right.
Yeah.
Definitely. All right. That's what I'm talking about right there.
Right.
That's what I mean. That's what we need in the community. We need people to be advocates. We need people who are in business to inspire the generation coming up, or even the current generation to continue.
Think big.
Think big, ingenuity, and all that other stuff. Yeah, definitely.
Yeah. Think big and just do what you want to do, and know that where you are today is not where you're going in the future. It doesn't have to be. This whole, I hear things that, sometimes in the lower income communities, like people, which are basically, in my opinion, basically war zones. You have people, little children who are basically suffering with PTSD and are acting out as a result. And I mean, if adults can't manage those environments and have PTSD, why would you expect children to? It's just ridiculous. And they don't even have a hope of living beyond like 17, 18. And again, it's just an artifact of poverty. They're trying to figure out how to get money quickly. What I like to tell people, this is kind of my internal joke I tell to my inner circle, but a lot of some of our best entrepreneurs right now in the Black community are in jail because they were on the corner running their business. It was just happens to be an illegal business, but they figured out distribution, they figured out money management, they figured out the marketing, they figured out the product and meeting a need. Granted, it wasn't the most moral need, but basically they were running a business and it was just an illegal business. But they had the mindset, all of the mindsets that you need of an entrepreneur, like how to assess the problem, how to address the problem, how do you build the infrastructure around it that it can be sustainable, that you can continue generating revenue, how do you then market it and find your customers, how do you manage risk and say, okay, I can be here at this time to this time, I can be over here at this time to this time, these are where my customers are. It takes a certain level of comfortability with risk to do entrepreneurship because it could potentially fail at any moment. And when you're in an economic deprived community, you're thinking, entrepreneurs are thinking, how can I make money quickly? And if you don't feel like you have opportunities to do that and you turn to something illegal, you're still an entrepreneur in my mind. You were just doing an illegal business. You're not the first to have that mindset. And then you go to jail and then everybody's like, how come there's not more Black entrepreneurs? And I'm thinking, because how can I go to jail? They were doing the best that they could in their environment. When you're in a high net worth environment, you're thinking, oh, I'm going to invent the next spacecraft. When you don't have access to that and you don't have money, you're thinking, I'm going to sell what people are buying in my community right now because it's a desperate environment. But the mindset and skills that it takes to do that are the same. I'm just saying.
I agree.
Definitely.
They need to reform all of those people who are in there for let's say drug offenses and selling things that are illegal, teach them entrepreneurship and send them back out to the community to go start businesses.
Right.
I'm just saying, because there's a distribution of people who have those skill sets in every community, right? Not everybody's made to be an entrepreneur. It takes a certain level of risk. It takes being able to understand problems and solutions and managing operations.
That's true.
I'm just saying.
All right.
All the components are necessary.
We have to get that out there as a political agenda. Educating all of the drug dealers, etc., people who are in jail for selling things they shouldn't be selling. Teach them entrepreneurship and how to run a legal business. Send them back out into the community. Because they also have a hard time getting jobs, so that kind of solves two problems.
That's true.
Yeah. But guys, it was a pleasure.
Thank you.
If there's any other way I can be helpful, let me know. And thank you so much for your time today.
Oh, thank you for your time. Thank you.
Oh, my pleasure. Okay, so until next time, I wish you guys a wonderful holiday weekend.
You too.
And keep doing what you're doing and bringing awareness to the community.
All right, we will
That's
do
the
that.
goal. That's right.
Yes.
Yeah, I feel like we should say hallelujah after that. Sounds
All
like
right. Thank you.
Hallelujah. I'll say it. Yeah. But yeah. Thank you so much.
Thank you.
That wraps up this episode of the Disruptive Podcast by Minority Innovation Weekend. If you haven't already done so, please subscribe. Check us out online at www.minorityinnovationweekend.org and connect with us on Facebook, Instagram, Twitter, and LinkedIn.